Can everyone hear me? Hi, my name's Apurva Desai. I'm one of the medical oncologists here. And this is a special program for all of us because it directly affects the cancer patients in Cancer Center. And the people you're gonna just hear some words from about the Cancer Center. David Snelson and his wife have been someone I've been seeing practically every week for the last year and a half or so. And David's been amazing through his journey dealing with MDS. And just want to hear his own words of what the Cancer Center means and what the music program in the Cancer Center means to him and all the patients. Thank you. David?
Thank you, Doctor. My journey here started back in December of 2004 when I was diagnosed as needing an aortic valve replacement. I was at Loyola Medical Center, had surgery performed in January, and at that time, since we're residents of Elgin, my wife and I decided that we really needed a cardiologist in Elgin. So I asked my barber, who had just gone through somewhat the same procedure as I had, recommended somebody at St. Joe's. We went there during the exam. She said I looked very, very pale. I was immediately sent to the laboratory over there, and it turned out I had a severe case of anemia. She recommended that I be admitted to the hospital. I was, and during my treatment in the hospital is where I learned that I was an MDS patient and candidate. At that time, I started receiving treatments at the Illinois Cancer Center, and after a couple cycles, it was determined that I needed a transfusion. Well, they can't do transfusions over there, so I was sent over to the Cancer Center. It was my first experience at the center, and I met one of the more friendly, angelic, caring individuals in Mary Gleason. I have to say that the doctors of the Illinois Cancer Specialists are some of the best I've ever dealt with. Dr. Desai is my primary doctor. Dr. Singh is a backup. And I have dealt with most of the other doctors. And hands down, I couldn't have asked for a better group of people to deal with. Also, of course, I have to say the nurses at the Cancer Center. I'm going to name them because each one has been a part of my life for the past year and a half. First off, Sherry, Joni, Crystal, Jeanette, Lauren, Heather, Amy, and I'm sorry if I've missed anybody, I do apologize, but I am very terrible with names. Also, the people at the reception desk make you feel very welcome when you come in there. That's Francis, Andrea, Melissa, and Christy. And the volunteers. This is a group of people that my heart goes out to. I don't know if I could do the work that they do. Then there are two people, Barbara, who works in the pharmacy, who I have to mention. And there's one person who sits in the background and who I have dealt with many times without realizing that I dealt with until just recently, and that's Rachel, who is a financial advocate. Secondly, or lastly, I have to take my hands off to Nancy, who is the manager of the nurses, and also to Stephanie. They run one heck of a program here, and for that I am very grateful. Now, as far as the music is concerned, I have been here a year and a half. Unfortunately, my cycle only brings me here one day a month, or one Thursday a month. And on those Thursdays, with the orchestra there, I have never met or I haven't met them, but I have listened to them, and it is a very soothing, serene experience that you're sitting there and all of a sudden the music just takes you away from what you're going through. To them, I take my hat off and thank them very much.
As a caregiver, we're kind of overlooked, but this group, they make you feel like you're part of their family. As my husband was going through this, we also lost our daughter to cancer. If it wasn't for Mary, Joni, Sherry, Crystal, Janet, who gave me support, hugs when I needed it, I don't think I could have made it. I love you guys.
So, since we have no more to say, I thank you for your attention. I'll turn the microphone back to Mary. Thank you very much.